Hello there, Andrew Anderson, and I have Dr. Victor Avis with us this morning. And so most people are watching, Doc, don't have any idea who you are, what you do. And rather than me go into a long blather about that, why don't you tell us about yourself?
Sure. By profession, I'm a general dentist in Staten Island, New York. I'm also the father of three daughters, and ages 27 to 31. And somewhere is about I guess about 8 years ago, I recognized in my oldest daughter that things that were interfering with her life significantly, like anxiety, fatigue, depression, um, just a digestive system that, despite being a healthy vegan, never seemed to feel very good eating anything. I started to put pieces together because of my own education, and I recognized that, my goodness, the root cause of the problem could well be an airway disorder, which I know people have no idea what that means, and I'll explain it in a second. But that
Breathing.
airway, let's say that
Airway means just the ability to breathe, correct?
the ability to breathe, but it's different from, like, asthma could be also cause a difficulty to breathe. So airway disorders, as I'm talking about it, are the upper airway from the nose to the voice box,
Okay.
and anything that causes a constriction or restriction to the flow of air, which makes you necessarily, not that you can't breathe, but without you realizing it, you have to create more effort to pull the breath in because you're sucking the air through a smaller tube, so to speak. And that gets amplified very often at nighttime, because at nighttime we're sleeping on our back or our side. So there's a postural change, as well as the fact that our conscious mechanisms to breathe are altered during deeper stages of sleep. And so this breathing disorder during the day can be amplified at night, such that all of a sudden you're not getting the restful, reparative sleep that every cell and organ of your body needs to be optimal. And so that's what an airway disorder is.
Okay. And I maybe we should start off with this, but what if they have an airway disorder or a breathing disorder? What are the symptoms? What can be the thing that struck me was learning disorders, ADHD, and quite a few other, especially in children. Can you just hit us up with that?
Yeah, I think first, it's perspective wise. I'd like to use a metaphor such that everybody who smokes does not get lung cancer. Well, why is that?
Right.
Well, because different people have different resiliencies, and so it is with airway disorders. So it can manifest or show itself as different signs and symptoms. So there could be 10 children that all have airway disorders. And let's think of children that are aged 2 and 3, and some have a history of colic and never getting sleep as a baby and being really difficult children, and others will look like, angelic children that slept beautifully from the time they were born, and yet they both could have constricted airways, and yet they're showing up differently. So
Okay.
it's very important to kind of look at all the signs and symptoms, but some of the most common ones with children, young infants, can be colic, very difficulty breastfeeding, ear infections, throat infections, many courses of amoxil or antibiotics as a child. And then as you move up to early childhood, behavior issues, focus challenges, ADD or ADHD like symptoms, or diagnosed ADD or ADHD. And then
Right.
as we move a little farther up the chronologic timeline, you can then develop signs and symptoms of anxiety, depression, continued social problems or behavioral problems, and then it manifesting in adulthood as high blood pressure, cardiovascular disease, diabetes, and then later on as dementia. So it's a continuum. And ultimately, it's going to catch up to people. Some people it affects, like with my daughter Sydney, early on in her life, and it showed up as terrific fatigue and tiredness. Others, it may not show up till all of a sudden they have high blood pressure, and they said, "Oh yeah, I snore," and that could be a sign. So by the way, snoring is not normal. Snoring is been made to be a laughable or funny event through media, but snoring is a indicator of a clear airway disorder, as is mouth breathing. So
Mhm.
people that are breathing through their mouth rather than through their nose have an airway disorder.
Yeah, and then I grew up in the Midwest, and if you called someone a mouth breather, it always meant that they were diminished in some way. They weren't real snappy, and that could have actually have some basis in fact because they weren't getting enough oxygen, so it slowed down their ability to think.
Yes, it's kind of like, those old wives' tales or things that our mother or grandmother knew
Right,
were rooted in significant, reality. And yes, so mouth breathing was associated with being not smart, being
right,
adult,
right.
DOLT. And indeed, there's basis in fact, because when you don't get enough oxygen night after night after night, it's going to affect your full cognitive ability.
The purpose of your organization is one to awareness is one of the things, and then two to let people know that there's solutions for it. And going back because I think that I had never heard of this before until like 6 months ago, and then even then I didn't dig into it. Um, but what surprised me was when I saw your story with your daughter that I know so many people that have children that have those same symptoms that and instead of putting them on drugs because of X, Y, or Z, that they really need to examine this first. And I don't know what statistics you have, but what portion of do you think that the children out there now have an airway disorder that may cause them these other symptoms that are out there? If you can give me an estimate.
Yeah, so I will tell you that I don't believe that we fully have our arms and mind wrapped around the numbers, but I can tell you the ones that are published and that come from good sources. The head of medical school, Marshall University, and the co-author of the definitive book on pediatric sleep disorders, he believes that 80% of children with airway disorders and
Mhm.
sleep disorders are undiagnosed, and
Okay.
that 40% of children that are on drugs for ADHD, so things like Ritalin and Vyvanse, so they're amphetamines, those drugs,
Right.
should not be on those drugs at all. That it's a misdiagnosis. So I'm going to say it again: 40% of the kids that are on drugs for ADHD should not be on those drugs at all, in Dr. Gozal's opinion. And of the other 60%, they'd probably be on a much lower dose if they would at least get a sleep study and be evaluated for an airway disorder. So that's in the childhood population. It's pretty darn significant. And know that amphetamines are drugs that cause a higher risk for drug abuse later in life. So they're not drugs without significant danger to them.
Right. Yeah, this has been going on for a while, and without even getting controversial, you just take logic. That's why the drug problems have been getting worse and worse, and they can't keep pointing fingers at us because the kids are getting drugged up when they're early. Um,
And I
so
want to just say one thing. It's
right,
not that those drugs aren't ever needed. That's not what I'm saying. I'm
right,
saying that if your child, a study of one, because that's as a parent, that's who you care about, has behavioral and learning issues, at least do a sleep study, because that could be the problem or part of the problem, and it could either avert the use of medication or lower the dosage. And so we should at least diagnose before we treat. It's a tenet of medicine and dentistry: diagnose before we treat. And I think when it comes to airway disorders, far too often this is forgotten.
gotcha. And then so the sleep studies, the ones I've heard about, they've got them for children now. You're not talking about going into overnight somewhere else and putting them on. You're talking about keeping it at home and then putting a ring on them, as I understand it. What are we looking at cost wise to do a study for that? Just roughly.
Yes. So I think, first of all, that more often than not, if people have medical insurance,
Mhm.
it's very easy to get it covered completely by medical insurance. I haven't had a patient that I've referred for a sleep study based upon, a host of symptoms.
Mhm.
So for a child, it could be, hey, I get frequent sore throats, or I get earaches, or I have trouble learning in school, we should do a sleep study. It's going to be covered. If you went out of pocket, there are companies now doing it for $99 a month, where you
Wow.
could get a ring sent to you, do 2 weeks of sleep study, so they have multiple nights, and
Mhm.
then have a sleep physician interpret the results. So it's very accessible, much
Mhm.
more so than 5 years ago.
Yeah, that's great. And then you're going to be speaking about this at the get together for Totality of Care in Knoxville coming up in May. Could you give us a synopsis of what you're going to talk about and why doctors and dentists and healthcare professionals should come, listen to you or jump online? We do have virtual tickets too.
I think the profession, more and more professions of dentistry, medicine, speech and language pathology, dental hygiene, are recognizing more. But remember, still, it's a small percentage of the population. How insidious, problematic airway disorders are, meaning the effect on overall health and well-being. The real breakdown that I see is in diagnosis and treatment amongst these professionals, because getting a sleep study has become much easier, as we just mentioned. But then interpreting the results and leading the child or the adult to a successful outcome, there is such a disconnect or such an opportunity to do much better. And so,
Mhm.
what I'm going to speak about is what we know about diagnosis and treatment. So, for instance, Andrew, you could have a constriction in your nose, at the
Mhm.
back of the roof of your mouth called the soft palate, the tongue base, or your epiglottis. If you're at nighttime, your tongue is falling back and blocking your airway, a CPAP machine, which blows air through your nose or through your nose and mouth to blow open the airway, is
Mhm.
usually not going to be effective because the tongue muscle is too strong.
Right.
If the constriction is your soft palate, it can be very effective. Well, believe it or not, at this point in time, nobody's hardly ever is that differential made. So it's more like, okay, your sleep study showed you have some sort of a disorder. We're going to try CPAP. And people very often fail. And are they failing because it's the wrong mask, it's the wrong pressure setting, or because it's the wrong treatment because they have a tongue base collapse?
Mhm.
And so that is an example of what's going on in the space of diagnosis and treatment, is that we're very incomplete from the time of a diagnosis to applying the correct treatment. And
Right.
most people aren't even given the options for all the potential treatments there are. And very often it's a combination of treatments. So maybe, Andrew, in your case, we'd have to fix your nose plus use a CPAP machine. Or maybe, as in my daughter's case, the only solution was upper and lower jaw surgery. And
Mhm.
so we know better, but the general population of physicians and dentists and SLPs and dental hygienists and DOs do not know this. They only know, if they learned anything about it, they only know their silo.
Right. And that was for most people 10, 20 years ago. And so this is now LMU, which is Lincoln Memorial University, is now starting to put this or help put this in the curriculum. So the newest dentists and doctors are trained on this and hygienists and everything else. Is that what we're happening now? And then
Yeah.
it's going to take a while, 10 or 15 years to get out in the general population?
Yes, Andrew, LMU stepping up and hosting this symposium is a huge event, because we need universities to embrace the importance of airway disorders in medical and dental education. So, number one, tomorrow's doctors are ready to serve this epidemic of health issues in our population. But number two, it gives a level of importance and credibility to how big this issue is. And we hope that LMU becomes the leader and others follow, because it's good medicine, it's good dentistry, and it's good business, quite honestly, because so many people need this care, and it can help avert cardiovascular disease, heart attack, stroke, which are still the number one and three killers in America. We need this in the universities.
Yeah, no, I totally agree with you. And one of the things too, I'm glad you brought this up because everybody's talking about, the expensive healthcare and whatnot. But from what I've seen, because I'm coming from a marketing background, the dentists and the doctors that adopt this, they have healthier patients and they have healthier practices because they can diagnose the issue quickly and immediately and take care of the problems, and that helps their practice because they come back to them. They don't have to get the runaround. And so the better the diagnostics, and this is me talking, not a medical professional, and the healthier the patients, the more the doctor's going to make. But the insurance companies will save it long term. So it's kind of a oxymoron, I guess. So or is it?
Yeah, I think it is to some degree. To lay people like yourself, it's so obvious that how can this be? But when you're in a silo, and medicine's its own silo and dentistry it's its own silo, you're getting trained in schools to do certain things, and this continues to fall outside the box of what's traditionally been trained in any medical curriculum or any dental curriculum. And so you have a legion of mostly untrained medical and dental professionals. And so it's very hard for people who have learned something to incorporate something new, or maybe unlearn something that they've learned and say, hey, maybe that's not correct. So, for instance, in the field of orthodontics, it's been since the 1950s for crowded teeth. Um, it's taught in every dental school today that a legitimate course of treatment can be to extract adult teeth so that you make room for the crowded teeth. But we should question that, because when you extract teeth, you make the mouth smaller, there's less tongue space, the teeth are retracted, so the airway potentially gets compressed. And so maybe we should not be extracting teeth and expanding to make room for all the teeth. And so that's a paradigm switch that's very difficult for those that have been indoctrinated that this is how we do it and this is how we've been doing it for the last 80 years, to accept maybe we should be thinking differently. And so that's why I say sometimes for lay people or young doctors, it's so easy to teach this because it makes so much sense. But for those who have been practicing, unlearning, for all of us, it's challenging to unlearn something we've been doing. If we've been tying our laces the same way all the time, tying them differently is a challenge.
Right. I totally get that. Well, anything else you want to add? I don't want to make this to a longer thing, but everything that you said makes so much sense. It's not even funny. I mean, and and so you don't have to be a healthcare professional to tune into this stuff, correct? Would a layperson, like if someone had an issue, would they get something out of attending this or watching it online?
Yeah, so Andrew, I think it would be a tremendous opportunity for people attending, because most people, when they hear my daughter and I speak, they quickly want to jump to, so what's the treatment? And
Mhm.
we're going to cover what the treatments are in their greater entirety and scope, so that people could be, both professional people and others can be educated to all the potential options that they have, either for themselves or a loved one, so that they're better educated, because they're typically going to know more than their pediatrician or pediatric dentist or general dentist. Um, but but we need to raise the bar. So treatment is a big piece that is misunderstood.
Anything else you want to add before we wrap up the interview here?
Yeah, I think you said earlier that the future is here, but not well distributed. And you were talking about AI and marketing, and I agree, the future is here, but not well distributed when it comes to understanding airway disorders. Just for dentists, it affects dry mouth and the microbiome, so your susceptibility to dental decay and periodontal disease. So it's so small as that. And for medicine, the connection with acid reflux disease is huge. So some of the most common things that seem benign, like a cavity or acid reflux, can be so integrated with airway disorders as a root cause. And so it really is affecting each of these professionals in their daily practice. And we just really need to open eyes so that we can treat our patients better.
Yeah, that makes complete sense. You brought up something, and I'm going to chase this squirrel because of I just became familiar with it. You're talking about the saliva test or the spit test, and that's been because you're mouth breathing, it changes the pH or the ability for the bad things to grow. And as far as I know, and correct me if I'm wrong, having the wrong biome in your mouth has been linked to cancer, heart attacks, strokes, dementia, Alzheimer's, kidney disease, bone loss, and a couple of others I'm sure I'm forgetting. So is this could be all connected because you have an airway issue? It's messing up your oral biome, which could lead to all of those other things, or in
100%. And we started off with saying this is about breathing, and since we all breathe, otherwise we're not no longer alive. We take it for granted, but then you get more cellular, like you're talking about, and yeah, breathing impacts the type of microorganisms living in your mouth and in your gut, and those microorganisms are far more the population is far greater than our own cells, and so how we cultivate and treat that microbiome is significant, and breathing has a tremendous impact on it. We can't get away from it.
So to kind of wrap this up, so the impact of improper, a not a correct airway, or what would you call it, a healthy airway?
Yeah.
So in children, maybe up to 80% are undiagnosed, correct?
Yes.
And according to the doctor that you talked about, that up to 40% of the kids that are on drugs for ADHD might be reduced or gotten off them. Is that correct?
Eliminated. 40% would not be on the medication at all, and the other 60% would be reduced.
Oh, wow. Okay. And then we also have it impacts how long you live. You can be shortened by 10 years. Is that correct too?
I think we don't know how great the impact is, but it would not be far-fetched to say that. And by the
Okay.
way, Andrew, as you're wrapping it up, I mean, the whole key of this LMU symposium is this medical dental collaboration. So you're going to have cardiologists, preventative cardiologists, experts in salivary diagnostics, experts in airway disorders, all coming together, speaking about the impact on health and wellness. It's a rare collection of experts and individuals from medicine and dentistry, and others coming together to talk about how we can impact well-being.
Okay. Anything else you want to add here? I'll give you the last word on this one.
Well, I think you've done a great job, and I hope you're very successful in marketing it, because it's an unusual educational platform, and I'm very happy to be a part of it. And I've also brought a number of speakers to LMU for this event, from cardiology, from dentistry, that I know are amongst the very best. So this is an opportunity second to none, because it's not dental running dental, it's not medicine running medicine. It's a group of medical and dental professionals collaborating with the university to bring together an eclectic educational experience that's really nothing can match.
Right. Well, this is the first time that I've ever heard of dentists referring to a doctor and a doctor referring to a dentist. And I mean, and working together to come up with a treatment plan. They're usually just like, my dentist has never said you should talk to your doctor, and my other doctor, except for one a long time ago, never said that to talk to, the other profession. It's just crazy because they're linked. You cannot separate them if you want to get the best treatment for the patient.
It's true. There's a multidisciplinary reality to healthcare that it's difficult. It's a reality that we need to embrace for the best care of our patients. And Dr. Joe Puma, who's on the program at LMU, and you may get an opportunity. I mean, he said to me, he said, Victor, I get more referrals from you than I get from any of my cardiology colleagues. I'm the dentist, and he's in New York City, and that's what he has said to me. And I'm telling you, together we have saved, in the last 6 months, we've probably saved 7 lives of people that, from me recognizing their airway issue, their periodontal disease, and referring for a CAT scan with Dr. Puma, they've then needed either open heart surgery or cardiac stents. And
Wow.
these people have had doctors already. And I just put together, hey, peri disease, symptoms or lack of symptoms, age, and these dental things that I know, and said, let's at least check it out. And
Right.
so That's the multidisciplinary reality that needs to happen.
So the news is that any dentist or any doctor can learn this in a relatively short period of time, the signals, right?
Absolutely. You could leave that 3-day conference and really know enough to be a better diagnostician to make good referrals. You don't have to be do procedures. I don't do cardiac intervention, but I can be a heck of a referrer.
Right.
I don't hardly do an airway disorder procedure in my office, but I
Mhm.
recognize them and I help people navigate the space. But others can be treat airway disorders, and others on that LMU program do actually either do surgeries or orthodontics on young children relative to airway disorders. So you could just like I don't treat oral cancer, but I need to diagnose if I see a lesion that I'm suspect is might be cancer, that I make a good referral. And so I think it's our responsibility as professionals, whether you're an SLP, a dental hygienist, or a DO, or an MD, or a DDS, that you recognize signs and symptoms and make appropriate referrals.
That makes sense. I mean, because you don't have to be a professional to realize that someone has a flat tire or how to fix it, but you can tell it's a flat tire and you need to get some help. So that makes
Yeah.
sense.
It's a matter of responsibility. You know, if you know more, you need to do more. And we just know too much at this time. And that's why for universities to not be teaching this, they're not stepping up to the plate responsibly, and they'll hide around, well, it's not part of the coda, the curriculum for accreditation. And I don't care. If this is important for patients' health, you need to train your future doctors to be better diagnosticians. That's what it's about. So
Right. Well, hopefully this is the first of many events where you go around the country and you can teach both doctors and dentists and hygienists and nurses and nurse practitioners and everyone else to recognize these signs. So at least you could help save people's lives or get people off drugs. Hopefully it's a good start with this. So thank you
Andrew,
for your
I'll say one other
go
thing.
ahead.
I
Go ahead.
I think that for as a dentist, I can speak for that my profession.
Mhm.
What an unbelievable opportunity to make a difference in the lives of your patients. And when your career is over, it's not going to be how many fillings you did or how many crowns you did. It's really going to be what impact did you have on the people that you took care of and that looked up to you as a trusted healthcare provider, and being involved in totality of care, the connection between the mouth and the body is just an unbelievable opportunities for dentists to assume a leadership position in healthcare. And so I can't tell you, it's so exciting for dentists and dental hygienists and SLPs and physicians to be a part of this. It's never been more exciting.
Oh, well, that's good to hear. And I can only imagine, when you can help change someone's life or actually save it too. And people probably see their dentist more often than they see their doctor. If I'm at least people that I know, they go to their dentist regularly, but they haven't seen a doctor in a year or 2 or 3 years.
Yeah, the relationships between patients and their dentist and or their dental hygienist is very often such a long-term relational piece. And so that's why we have such an opportunity, particularly with the increase in walk-in clinics as being the physicians of the family.
Right.
Now the dentists and dental hygienists become those trusted providers. And so that's why it's so important for that group of people to know this information and to own it.
Right. And so even the hygienists, and not even, but anywhere from the hygienist all the way down can step up to the plate and learn this and start making referrals and get the dental office and get the doctors involved. And it seems
Yeah,
fairly easy and straightforward to me, but I'm a layman, so that.
it's not difficult to learn, that's for sure. It's not intellectually beyond anybody that'll come to that meeting. And once you learn it, you can't unlearn it, and it will help you be a better doctor and a better professional. So I agree. It's both learnable and applicable and very important, and is part of our responsibility.
Okay. All right. Well, I said I was going to give you the last word. This really is, you could take it away here. How do people find out about your organization? We can't
Yeah.
forget.
So the Airway Revolution Foundation is a not-for-profit 501c3. It was co-founded by my daughter and I. When we recognized her airway disorder, we said, you know what, we need to help people be aware, because most people associated airway disorders with overweight middle-aged men. And here my daughter was 25, fit, yoga teacher, healthy vegan, and yet she couldn't have a quality day because of fatigue. And so we decided to film her journey. We're almost finished filming after 7 years, but we have filmed stories all over the country of people of different ages, gender, race, religion. We want everybody to be able to see themselves in a different story. It films all different types of diagnoses and treatments, from Inspire to MMA surgery to CPAP and mandibular advancement devices and cognitive behavioral therapy for insomnia. So our whole purpose is to raise awareness amongst lay people, but more than that, to create a galaxy of people who are behind our foundation, so that we can affect change at the congressional level, increase NIH funding, change Medicaid and Medicare policy to increase reimbursement, so that we can make airway care not only better, but more accessible and affordable to tens of millions of people that are suffering in America and beyond our borders globally.
Right. Well, that's a great cause. And what's the website again?
Yeah, airwayrevolution.org.
Okay, we'll make sure we'll put that in the link for everybody. And we'll also put a link into the Totality of Care so they can get more information about that. Thank you for your time. I appreciate it. This went a little bit longer than 10 minutes, but be that as it may, that was great info. So thank you, Doc.
Okay, you're welcome. Thank you.